a CRG series in the Corona times. 6 lectures on migrants and refugees. In collaboration with Rosa Luxemburg Stiftung, South Asia, and Institute for Human Sciences, Vienna. The COVID-19 pandemic has ushered in an era which, even without it, appeared as building on its inheritance of displacement, discrimination, and disparity. Yet, ours is also an era which inherited the idea that empathy isn't alien to law, politics, or to any field of knowledge or activity. That in certain luminous moments, hope and history rhyme. The unprecedented scale of forced displacement, its growing catalysts, and the distress darkening it present immediate challenges for migrants and marginalized people all over the world. The 6 lectures in this series by Calcutta Research Group explore the conditions of migrants in the present day. They investigate issues of protection, vulnerability, neoliberalism, statelessness, international law, and ethics. Lecture 6: Ethics of Care, Public Health, and the Migrants and Refugees. The speaker is Paula Banerjee. The phenomena of forced displacement offers a fertile field for raising questions of ethics. On the question of providing international protection to the victims of forced displacement, the Global South faces ethical issues different from those faced by the Global North. The questions of care and justice in the Global South have been aggravated manifold by the pandemic.
Hello. Today I will speak on questions of ethic, pandemic, and the migrant worker. On March 24, 2020, Narendra Modi, the Prime Minister of India, announced a lockdown for 3 weeks. Now, the background for that was the novel coronavirus, or SARS-CoV-2, which ultimately resulted in a pandemic. This novel coronavirus is better known by its shorter name, or COVID-19, an acronym. At that time, one didn't realize that it would emerge as a pandemic because in India, the number of infected people were low and the death rates were also low. However, this particular lockdown affected most the workers or the working class people. The middle class was foraging for food at that time, trying to think how they will get their groceries, how they will get their medicines. But for the workers, it was a pursuit for life, a life of dignity. Now, there were about 400 million workers in India at that time. For them, this was quite a difficult experience, but among them, there were at least 139 million migrant workers. For them, the experience was catastrophic. These workers wanted to go back either to their homes or go away from the cities. Because here in this urban center, they had a very, very problematic life. Their jobs were no longer there. The factory owners or even households clearly did not care about what would happen to them and let them go or made them redundant. So in a city where expenses were huge, these workers, without their jobs, without too much of savings, because one has to remember most of their savings went back to their villages. And that is why, in the context of village economy, they were considered as essential workers. And these workers, therefore, wanted to go back to a life of dignity. However, what happened as a result is that these workers lined bus stops, they lined train stations. Huge numbers of them were doing that because they wanted to escape the cruel city where they were working. But what confronted them was another wall, and that is they were told that the buses were stopped, the trains were stopped, and nobody was there to care for them. Their care depended, in fact, on individuals. Some of them political individuals, the local MLAs, probably the MPs, the councillors probably took care of them, but there was not a system taking care of them. So they went back to wherever they were staying and continued or hunkered down for 3 weeks. Then again, on 14th of April, once again, when the first lockdown ended, another lockdown was announced by the government, and that lockdown was supposed to last till 3rd of May. These people could not hold any longer. Again, they queued up in bus stations, they queued up in train stations, but no escape. So what happened was that whoever had resources, they started hiring, buses, other transports, sometimes rickshaws, and the poorer section decided just to brave, the walk. So they started trekking to their homes, to go back to their homes or their villages or anywhere. They did not want to brave the city any longer. In that kind of heat, in that tremendous heat, without food, without money, without transport, millions started walking back. And the inevitable happened. These workers, hundreds of them, braved death in pursuit of life. News started percolating. 3 people died in the border of Madhya Pradesh and Maharashtra. How did they die? They died of dehydration. They died of lack of water, lack of food, starvation, etc. And these news started becoming a daily feature. That's when the government decided that probably enough is just about enough. And they declared that they would start what was called a Shramik special. Shramik means worker. Worker special trains from their jobs to their destination points. And apparently, within the next couple of days, 4,277 Shramik special started, and 60 lakh workers apparently took advantage of that and went back. But even those specials were not safe, because what happened was that again hundreds died within those trains, which were like black holes. Hundreds of people piled on top of each other. Nobody really cared that a pandemic was on. And this sort of distancing between each other, or no distancing between each other, meant that the workers, there was a very big chance that these people will now contract the pandemic and will become the super spreaders. When they reached their destination, therefore, they were treated as pariah. The villagers said that these people lorded over us, they were treated as essential workers, but now, when they're not accepted in the city, they're running back to the villages. Where is ethics in all of this? Where is ethics of the government? Because these workers had to be quarantined even after quarantine, after braving death, after braving so much of trouble. they were not accepted back in their homes. Most importantly, if they were women, they were even more unacceptable. Women were willy-nilly sent back from their doors to government camps or wherever they could. So it is a very, very problematic situation because you see, now the essential workers in the villages became people from whom social distancing, a new terminology, social distancing. Remember the caste system in India? We are very apt at social distancing. That started against the migrant workers. So much so that they, who had promised that they would never return to the cities, decided that they would have to go back because there were no job opportunities from where they had returned. And in between, what the government did was to take away all social security, the meager ones that these workers had. That is the number of hours that they were entitled to work. So their leisure would not become shorter, their job would not have any security. Again, we return to the question, what happens to ethics? See, the interesting thing about migration studies is that migration studies is always dependent on what happens to the migrants. So migration studies have always walked hand in hand with what was happening to the migrants. And so this was a new situation. Before, migration studies was dominated by the lawyers, by the anthropologists who tried to study the micro picture, the lawyers, policymakers who were doing policies for these people. But now, social scientists were becoming important in the studies. Migration studies had a couple of years back, or maybe about 2 decades back, opened up to Asia, Africa, Latin America, etc. People who are known as scholars from the global south. A misnomer, but anyway. So these people actually already started steering migration studies away from the typical West-oriented, law school-oriented migration studies. These people were asking other essential questions. What happens to the people who are vulnerable when they become, confronted with new acts such as the Forest Act, such as the Urban Development Act, and why are they therefore forced to move? So, instead of looking at how these people were surviving, they were looking at root causes. Why were people forced to move? What forced them to move? What kind of wars? What kind of riots? What kind of developmental crises? Who were responsible for these wars? And again, the global south went back to the C word, colonialism. What happened during colonialism? And how that created borders, that created a political paradigm, that created a developmental paradigm, or people responded to that with their own paradigms that ultimately led to multiple conflicts in the global south. Many of them directly made as a result of the development that was carried out with the money from the global north, the multinationals. What is the kind of development that they are doing? Do these people in the global south have safe water as a result of that? Safe environment to live in? So you see, all these moot questions were therefore being asked by the global south, and there was a whole crop of scholars who were informed by the global south in the global north, and a lot of scholars who went from the global south, many Indians, many Africans from South Africa, from Nigeria, from Kenya, were teaching in universities, the hallowed spaces in the United States or even in UK, in Australia, they brought those questions to the political discourse, as a result of which new questions started coming up. And these questions related to ethics. What is the ethics of the state? What is ethical? How is it ethical to deal with these people? Here again, I will have to talk about Carol Gilligan. We all know that Carol Gilligan was probably the mother of what we call the ethics of care studies, because she interpreted it and sort of it was brought down. I cannot say reductive, but because it sort of expanded the scope of women's studies and feminist studies, where she related it to the morality of care. Care for you, care for us as well as care for them. Now, who is responsible for that care? The site of that care, of course, were women. So therefore, the ethics of care that was devolved as a result of Carol Gilligan's work, and there were many other scholars who talked about it. And these scholars, therefore, talked about compassion, talked about friendship, talked about care for the old, talked about concern for others, etc., which was cited within what we called the site for women, a site that was controlled by women. Side by side, for migrations, largely from the global north, developed another kind of care studies that was based on the care of justice. These people who propagated the care for justice, they talked about equity. What was equitable? They also related it to the questions of rights. What kind of rights people have? As Hannah Arendt said, to claim rights, you need rights. So, studies of forced migration, therefore, became pursued through an ethical line, which was clearly asked during the last pandemics. But it had already started being asked, because the most important thing for refugees is the notion of protection. Who protected the refugees? Who protected the forced migrants? And therein came the specific question of the ethics of care. Why is there a border regime? And that is the question that was asked, that reverberated in these universities' A-load halls. And how is this border regime, or how can this border regime become ethical? This is a very problematic question, because in this question lay the whole notion as to who can be a refugee. If you make a claim, you cannot automatically become a refugee. You have to follow, what the 1951 Refugee Convention had delineated, and that is, you have to show that you are a persecuted person. How can you show persecution when the cause of your migration is starvation? Can you show persecution? Can you show that the states have structurally developed in such a way that huge groups become migrants because of starvation, because of climate change, because of salinization, because of the development paradigm that the countries have selected? And mind you, one has to remember that even though the Universal Declaration of Human Rights says that people have a right to move, but countries are sovereign. So they have a right to take in refugees that they want to take in. So here it is a clear choice of people who run a country, the elite group who form the government, and they decide who they will take in. Border regimes are not formed or developed on the question of who will be taken in. Rather, it is developed on the question of who will be kept out, like Syria. What happens to these people? Everybody, everybody says that Syrian people, when they move out of their own borders, are refugees. But people close gates to them. Jordan, after taking in 4 million, decided to close the borders. And their argument was, how can we feed so many people? So herein, we come back to the basic question, and that is, countries have a responsibility to their own citizens. And only then, like the reader says, the limits, the politics of friendship. And what are the limits of that friendship? What is the limit of that hospitality? You cannot be hospitable. A family cannot be hospitable unless they can feed their own people. However, another question arises in all of this. What if a country tries to feed its own people but is unable to do so because of other forces? Therefore, we have questions of ethics based on issues of who sponsors wars, what causes those wars. This is a very important question because herein lies the claim of the global south. Wars might happen in global south, but who is providing the armaments? Who is creating causes for those wars? Do those countries become refugee receiving countries? Is it not ethical that they would receive the refugees? Is it not ethical that they would stand up and bear the consequences of their own action? So therefore, we have these questions surrounding policies of different countries when they have caused a war, when they have caused a developmental crisis. Because you see, refugees do not, or most of them do not go to the global north. They remain within the global south. So, if we look at Syrian refugees, who gives them asylum? Largely. If we look at Afghan refugees, almost 3 million Afghan refugees are in Pakistan. Huge number in Iran, some in Iraq, some have come to India. So you see, people, the originating places for these refugees are the poorer, developing post-colonial countries. But the causes for displacement in these countries is related to the causes that have emanated from colonialism, that have been brought down from global north, etc. So therefore, questions become more relevant because these countries on whose borders the refugees appear, how ethical are these countries? Can they deny refugeehood to persecuted people? A couple of years back, we had the horrific stories of Rohingyas floating in boats, floating in ships, and no country is giving them food or even the order to come and at least land in their countries where they can be given humanitarian aids. So 1/3 of the Rohingya population in the boats were dying. And also, what happens when these people come to different countries? India deported and returned 9, 10, 11 Rohingyas completely flouting. The numbers were small, but even with that small number, one has to realize that they were completely flouting the non-reformer cause. Of course, the government of India can say that we are not a signatory of the 1951 convention, but there is proof that even when countries are not signatories of the 1951 convention, then even then, you know, countries give them asylum, or at least they do not send them back into their own borders where they would be definitely persecuted. So non-reformo actually is a very, very important clause. But yet now countries are willy-nilly flouting that all of a sudden. What happens? We always say that to become a refugee, you need resources. But what happens to the completely vulnerable, completely pauperized people? Many of them are women who do not have resources even to become a refugee. They become what is known as the internally displaced person. Now, the ethical question arises, and that is the system, the government, which actually displaced them in the first place. These people could not go away from those governments. They had to remain within the political borders of these governments. So, what kind of subject position in that? And isn't that an ethical dilemma for the countries? How can they ethically provide for people who they have displaced? If they displaced, isn't it ethical for them to first look at their rehabilitation, to rehabilitate them before flooding their areas for a big dam, to rehabilitate them before engaging in bauxite mining in Orissa, to rehabilitate them before creating laws like the forest laws where they would be completely pauperized? And how do researchers deal with these questions, deal with these ethical dilemmas? If we consider the right of the states to move people, what is the right of the people who are evicted as a result of these policies? Whose rights is more ethical to maintain? The right of the people who are being displaced, or the right of the state to displace them and deal with them in a way that they want to? We also come back to the questions of finance and burden sharing. Who shares the burdens? Most countries in the global south complain about the burden of migrant populations. How can we save the migrants, provide for the migrants when we cannot provide for their own people, for our own people? So, the countries who are responsible for moving these people have to share the burden. They have to financially provide these people. That is their duty. So, for pocket change, you are abrogating these countries from their duty. Wouldn't it have been right for them to share the burden of the refugees when they are responsible for their displacement? But countries from the global south cannot dictate it to the global north. A lot is dependent on other kinds of aid, developmental aid, other kinds of economic aid. The whole apple cart is dependent on them. So they have to be happy with pocket change for the people who are facing humanitarian crises. Again, we come back to questions of ethics of care and the ethics of justice. Researchers who are doing research in this population, they have to be self-reflective. They have to understand how migration ethics can be spun, can be developed, can be constructed. Because all these researchers often work with people who are extremely vulnerable. What happens when you are working on trafficking of women? When you are working with people who have been trafficked? What kind of research ethics should guide you? Because if you are not an ethical researcher, you can then, be the reason for enormous harm to these people. Their traffickers have the ability to make them so desperate that, they prefer to surrender to the police. So therefore, one has to be self-reflexive as to how, while doing your research, you maintain the ethical questions. Also, what happens when, as a researcher, you know that the information collected from these people, from the forced migrants, have been collected because of duress? How, as an ethical researcher, can you use that information? So, within migration research, and many of you will take this up as your research, you have to understand that your questions have to be informed by ethics, your motive have to be ethical, and your results have to be documented in a way which is ethical. So, what kind of research is ethical research? If you are working with a precarious community, it falls upon you to do it with complete transparency and with total trust. You cannot use these people and throw these people. You have to develop, as a researcher, a relationship with these people. That is how they will open up to you, only when they have trust in you. So, all of you who are working on migration studies have to realize that you have to be ethical people, people with empathy. That is the only way you can do ethical research. You have to develop friendship. You have to have sympathy for these people and make sure that whatever you produce as a result of these, studies, you have to take it back to them and also give it to the policymakers or the states. Now, the states will talk about the individual rights, but the individual rights makes it possible for the state to abrogate their own duties. And this inevitably happens during a pandemic. When mass groups are migrating, they abrogate the duty of caring for their citizens. Internal borders become like external borders. These borders are manned, and I very consciously use the word manned, by people who put these migrants into life-threatening positions, but by not allowing them to move. The state does not do anything to provide for food, to provide for medicines, give medical help. So the duties that the state normally undertakes are often abrogated in crisis situation, saying that the states will care for the individual and not the collective. So the collective is displaced as a result of policies, but only as individuals will the care be given. So therein do we have the ethics of care. Now, I will conclude what I'm saying and bring it back in a full circle. This is exactly what happened to the migrant workers in India. Their health was not an issue. Their food was not an issue. Nobody was even there to look after their basic needs. Women gave birth on the road and after 2 hours picked up their babies and started walking again. As I said, people died on the way. Hundreds of people died on the way. There were over 1,400 road accidents. There were so many people dying, women and children dying. And everybody, all the migrants became, the vulnerable communities. But they were treated like the people with whom you have to socially distance. If you are safe, you have to socially distance yourself from them. And the borders became international borders. The borders did not help them at all. The pandemic, therefore, once again brought to the forefront that where migrants are concerned, both ethics of care and ethics of justice are suspended. Even your own population, even your own citizens become refugees in their own land. They're treated as refugees and they die in hordes just because they want to live. So we come back to biopolitics and ethics become a distant dream. Thank you very much.